Don't pay attention to the doubts you have about your ability to pursue health sciences. Don't put it off. Just go for it and don't worry about how long it might take. 6 years really isn't that long in the grand scheme of things. I think something that inspired me to pursue pharmacy as a profession was watching my dad live with Parkinson's disease. It's a brain disease that affects movements in the early stages and gets worse over time. I was really fascinated by the way my dad's medications worked. When his medications wore off, he literally could barely walk. He would freeze and intermittently shuffle his feet. As soon as his next dose started to take effect, he could walk almost just fine. Observing this on and off phenomenon made me curious, and it really is a remarkable example of the power of Western medicine and how important it is to have a pharmacist on your healthcare team.
Growing up, I always had a very strong interest in science as well as in business. And when I was just talking with my parents and with my guidance counselors on what field would be best for me, pharmacy came up, and it just seemed like a very interesting career path to choose, where I can practice my love of science and helping people directly, but also getting to know the business and eventually being able to own my own business, whether it's through a pharmacy or working in a pharmaceutical company.
My favorite course in pharmacy school was a class called Complex Cases, where we were able to go through different patient scenarios who have many medical conditions and drug therapy problems, and we had to work up a care plan for each condition. And this was super interesting to me because it gives an insight to how complex and challenging it can be, and gives you an insight to real life practicing pharmacy is like, because not all the cases are simple, and most often patients are on several medications at once, or have more than one medical condition. The reason I found this class so intriguing in working up a complete healthcare plan because of the focus on individual patients, because I believe in patient-centered care.
Interesting fact, you actually don't need experience to be admitted into the PharmD program at the University of Toronto. So I did not have any pharmacy experience. I had only observed people working in pharmacies from the other side of the counter. So coming into the program, I was hoping that the experience I had developed in other areas of work, like communication, customer service skills, would be able to translate to pharmacy. And during the program itself, you do have clinical rotations that allow you the experience, the opportunity to develop your pharmacy practice experience as well. So that's not something that's needed for the UT program.
One of the challenges I encountered along my pharmacy journey was living with and managing depression, anxiety, and chronic pain. Some of the strategies I found helpful over the years is taking medications, exercising, spending time outside, and doing yoga and getting enough sleep. I'm mindful not to isolate myself, so I make plans to spend time with supportive family and friends. I've read a couple of books by a local scholar on Indigenous spirituality, which I found helpful. I use professional help like counseling, physical therapy, massage therapy, plus others. And this lived experience has helped me be better at what I do as a pharmacist when I'm mentoring students, caring for my patients, or just supporting the people that I work with.
Some advice I have is that you can do anything you want in this world. Just take each day one step at a time and know that any failures, mistakes, or things that do not go your way do not define you. Things will work out in the end if you keep moving towards your goals.
Coming into the pharmacy program, which had a significantly higher workload, where I had to learn that I can't do everything and I have to focus on one or two things that I enjoy, whether it's a club, whether it's intramurals, and then giving most of my time to school so that I can pass all my courses and get good grades.
Life is not a race, it's a long process, and you will get there in the end. And I don't think it's too late to start your academic goals. You can go to school at any age, and I believe with hard work and dedication, you can do anything.